Hi, Dr. Dinesh. Hi, Dr. Gaurav.
Hi, good evening.
Hi, Nishant.
I am Dr. Nishant. I am a senior manager here at Medigence, and we've been taking these sessions about cardiac pediatric health.
Yeah, right.
Yes.
So I'm a cardiac surgeon, and with me, Dr. Gaurav is there. He's a pediatric cardiologist. So I think there are a lot of myths about the surgery and catheter device procedures. So I think we are here, and we will clear these myths in this session, like that.
Yes, sir. Okay. I think that's our agenda already. So to start with, I think take this discussion forward and try to understand what exactly are cath labs and what makes them different from our regular procedures that you people operate on kids for. So if you can possibly try to differentiate between those, and then I'll continue to put in more questions as the conversation proceeds. Please.
So cath lab is a room, the room in which there is a fluoroscopy. So the procedures with the fluoroscopy, like X-ray. So it's a different version of X-ray. It is almost similar to X-ray, but it is different in kind of radiation with what we get from the fluoroscopy. So it's a live. So the moving things we can see in X-ray, we can see the still images, but in fluoroscopy we can see the moving images. So with the help of moving X-rays, we do the procedure. We heart, femoral, or vein, or in we can go from the radial artery, and then we go inside the heart and we close these holes or open the valves inside the heart through the femoral vein or femoral artery through angiographic techniques without any cut or scar on the body.
So I think here audience want to know what is the difference between a operation theater and lab, right?
Yes.
So like Dr. Gaurav has already told our audience what is cath lab. Cath lab is a room with certain kind of imaging, where with the help of imaging, they do the device closure of certain holes. They do the procedures without giving any incision, without giving any cuts on the body, right? Correct. In operation theaters, basically, we do the surgeries. Surgeries means we give the incision, sometimes small, sometimes a big incision. And in cases of heart, we will put that patient's heart on a certain kind of machine device. With the help of that device, we stop the heart and we do the procedure. Like if patient has got hole in the heart, we close that. Patient has got any blocks in the, we clear that blockages or something like that. So we do these surgeries or these procedures on that which we call cardiopulmonary bypass machines. Okay.
Yes.
So operation theater is one where we do these surgeries. A lot of hernia is going to be there. A lot of staff is in operation. We require at least 20 personnel, 20 people. I require a lot of devices, lot of machines behind it. Right?
Yes.
Yeah. Like a small video I can show you because this is in my phone. So this is in the cath lab. Can you see the video?
Yes, we can. We can. Yes.
This is the video in which this is the X-ray. This is the X-ray of the patient, and we can see some dye going inside the heart, and there is a hole here. I can play it again. So this is the hole. So the dye is showing that where is the hole. Okay. So this is the catheter from which we are giving the dye from the hair, from the femoral, from the leg, vein or artery. We are going inside the heart, and we are delineating the hole with the help of a dye. Dye we are giving through the catheter. And in the next video, we can see that we are closing this hole with the device. This is the device where my finger is. Okay. So now the dye is not going across this hole. So now the hole is totally closed with the help of this device. So like the surgeons do in the OT, they close the hole after opening the chest. We do in the cath lab. We go from the femoral root, we go from the leg and close these holes with the help of device without any cut or incision on the body.
Okay. Okay. So I think these were the major differences that you pointed out between a regular cardiac procedure and a cath lab procedure that we use. So
Right.
what is the doctor's advice if they have to decide which particular operation should be chosen for a child? For example, if a child comes to you, yes, what would be the
Yeah.
choosing criteria?
So when child comes to us, that depends on lot of factors. Depend on that, we decide about if child is require any medical management, child is required any surgery, or else child is required any cath lab device closure or cath lab procedure. Okay. So number one is the diagnosis. Most important thing is the diagnosis, because cath lab device closure we can only do in certain subsets, certain diseases only. Not in every diseases we can do the cath lab procedure. So if you ask me the number of kind of diseases we can, still in most of the cases child surgery only. But if we the percentage of procedures nowadays, I think almost 20-30% of the congenital heart disease procedures can be done into the cath lab. Okay,
Which is good.
so
Yes.
depend on number one, the diagnosis. Number two, maybe the age of the child, that is also important, because obviously doing a cath lab procedure, a certain age or certain weight of the patient is required. So I think these two things are the most important to decide child would going to require a surgery or cath lab device procedure.
Okay.
Right?
Following to the same question, for example, if you get a patient who is eligible for both of these treatments, they can have an open surgery also and a cath lab also. Which have you seen a better prognosis in general, if you were to compare between those?
Certainly nobody wants a cut on their body, right? So
Yes.
based on that, so before that, I think the better question is what is the advantage with the device closures, right?
Correct. Yes.
If we understand
Please.
what is the advantage with the device closure, we can understand which procedure to choose, right? So I think Gaurav will enumerate what are the advantages with the device closures, right?
Yes.
See, you have asked that what is the prognosis. I will come later. So with the device closures, what are we achieving? So with the surgery, we are closing the hole. With the devices, we are closing the hole. The results are same. Okay, and the life expectancy is also the same.
Okay.
So results are almost equal. Okay, but there are certain advantages we can say if the child is suitable for device closure. If it is not suitable, then obviously we have to go for surgery. But if it's suitable, if we can do both, we have both options, device or surgery, then what are the advantages of device closure? So in device closure, first, we don't give any scar, any cut, we don't give any cut or any suture. There is no suture on the body. There is sutureless procedure. Second thing is, we do not put the patient on ventilator. Most of our patients, they are not put on ventilator. They are not given general anesthesia. They are done in sedation, conscious sedation. Okay, so that is a big thing. Third thing is the pain part. So obviously, when we are not cutting anything, there is no pain. Oh, and fourth, big recovery. So recovery is very fast. We can send the patient next day. Very next day, we can send him home. But in cases of surgery, it takes 7-8 days for the patient to go home. And fifth thing is the child comes to his activity very fast, routine activities very fast, without any delay, without any pain, and without any other thing. And if we talk about the results, they are almost at par with the surgery.
Understood. Understood. All right.
So definitely it is cosmetically better. It is pain-free, faster recovery, and for early to work. I think these are the advantages. Results, both are same. And ultimately, this is patient choice. Yeah, patient choice is the most important. That is number one factor. Because sometimes patient choose to go for surgery, then it is okay. Yeah.
Like you would explain the advantages of a faster recovery and a
Certainly.
quicker process to them, obviously.
Yeah. You see, we always work as a heart team. Yeah.
Right.
So we take as a patient, we counsel them as a team basically, and we definitely explain them all the advantages and disadvantages of both the procedures. Then depend on that, what he choose, what is best for him, will do.
Okay, following a follow-up on this. So is there any difference in the preparation of a patient that needs to be done in a normal cardiac surgery versus a cath lab? I am sure that the preparation would be rather less, but I would like you to comment on that.
All right. So for surgery, I think preparation is little more extensive. We will do more tests because most of these patient has to go for the general anesthesia also. We have to, yeah. And most of the device closure, like Dr. Gaurav has already mentioned, is done in the either local anesthesia or under sedation only. Okay. So we always require a battery of tests, especially for the surgery, preparation for the surgery, for the sake of surgery. Right? So I think that is the not much major difference, but that is little bit of difference. Otherwise, almost preparation is almost same. Yeah, in terms of surgery or in terms of device closure.
All right, all right. And if you would like to take us through a certain set of procedures that are done with cath labs versus a certain set of procedures that are definitely done through a normal cardiac surgery. So I think that will majorly wrap up the kind of questions that we usually get from our audiences for pediatric cardiac care. And then I would like you to give us a brief and we'll wrap this up. Thank you. Yes.
Yeah, certainly. So there are some kind of subset that can be done with the device, no doubt about it. But there are subsets we can't do anything with the device. We can't do anything in the cath lab. Okay, like in the neonatal period, there are some procedures like we have to do the arterial switch. This is a complex surgery. We have to do in the operation theater only.
Okay.
So then univentricular physiology, we have to do Fontan operation. Okay, we have to do in the operation room only, operating room. Then now TOF physiology, we have to do TOF repair. Okay, tetralogy of Fallot's repair. We have to do in the operation theater.
Okay.
But like simple subset like nowadays PDA, patent ductus arteriosus, atrial septal defects, and certain kind of ventricular septal defects. These are the major subset we can take care of them in the cath lab. Okay. Out of them, only there are certain kind of patients, certain subset of patients, they are not suitable for the devices. We take them for the surgery. Otherwise, they can go for the device closures.
Okay. And the general time duration that is required for, let's say, a menial ASD or a PDA closure with device in a cath lab, how much time does the child spend in the lab during the entire procedure?
The time spent is almost 1.5 hours.
Okay.
Yeah.
And then follow up in the ICU, and then they can proceed with their recovery.
Yeah, follow up in the ICU. When the child wakes up, we give the feed. Then we can shift in the room on the same day or the next day. Next day we discharge the patient.
All right. All right. Thank you. I think these were a couple. Yes, please. You were saying something.
Yeah, generally with the device, we keep the patient in the hospital around for 2 days, and same day we keep them in the ICU. Next day we can shift the patient to the room and we can discharge. And for the surgery, we keep the patient for simple procedures. We keep them for the 5 to 7 days, 2 days in the ICUs. And generally these surgeries take around 2 hours. And cath lab, they take around 1 and 1.5 hours, something like that.
All right. I think I would really, I really appreciate you pointing out the major advantages between cath labs and general procedures. I'm sure that our audiences will be educated by this and will be able to make better decisions. And I thank you both for spending this time, and stay tuned. We'll have more sessions together. Medigence is preparing better and big things, and let's bring child's health to the priority. I appreciate, sir. Thank you.
Nice talking to you, Nishant. Okay.
All right.
Bye bye.
Thank you. Thank you, guys. Thank you.
Bye bye.
Okay.